Welcome to aminacademy.com, Abnormal Psychology. In that, we'll discuss about case studies, some introduction. Abnormal psychology is a branch of psychology that studies unusual patterns of behavior, emotion, and thoughts which could possibly be understood as a mental disorder. Although many behaviors could be considered as abnormal, this branch of psychology typically deals with behavior in a clinical context. Now, let us discuss some detail about case studies of abnormal psychology, some introduction. Case studies in abnormal psychology provides a detailed narrative of individuals with psychological disorders, offering a deep, holistic understanding of a disorder's manifestations, progression, and treatment by illustrating complete real life experience beyond abstract theories. These detailed accounts, often presenting the client's history, symptoms, and response to treatment, are invaluable for generating hypotheses, educating students, reducing stigma, and enriching clinical practices by grounding concepts in lived experience. Purpose of case studies: in depth understanding. Case studies allow for a comprehensive exploration of an individual's unique experience, providing context and norms that standardized data might miss. Understanding psychological concepts. They translate abstract theories and diagnostic criteria into real world scenarios, making them more accessible for students and clinicians. Hypothesis generation. What is that? By highlighting patterns and unique characteristics, case studies can inspire new research questions and hypotheses for future studies. Abnormal psychology hypothesis generation is the process of creating testable predictions about the causes, symptoms, or effective treatments of psychological disorders by identifying patterns and relationships in data, which then guides future research, data collection, and analysis to explain and ultimately treat maladaptive behaviors. This process often starts with observing a phenomenon, developing or selecting a theory to explain it, and then formulating a specific hypothesis about a new aspect of that phenomenon that should be observed if the theory is correct. Improving clinical practice. They help practitioners understand how disorders present in individuals, how treatments are implemented, and the trajectory of conditions over time. Reducing stigma. What is that? By presenting individuals' struggle and complexities, case studies foster empathy and a more nuanced understanding of mental health issues. Reducing stigma associated with abnormal psychology and mental illness can be achieved through education, promoting open conversations about mental health, and encouraging direct contact with individuals who have mental disorders. Using sensitive and accurate language, such as changing the course title from abnormal psychology to a less pejorative terms, also plays a crucial role in fostering understanding and reducing prejudice, according to research from SAG journals and Springer. Key elements of case studies: detailed descriptions. Case studies provide comprehensive information on an individual's symptoms, history, and the personal context surrounding their disorder. treatment and trajectory. They often include information on the formulation and implementations of a treatment plan as well as how the disorder progresses over time. Holistic perspectives. What is that? Case studies illuminate the interplay between an individual's background, triggers, symptoms, and responses to various inventions, offering a more complete picture. A holistic perspective in abnormal psychology views mental health and illness as complex and multifaceted, recognizing that psychological disorders arise from an intricate interplay of biological, psychological, and social factors. This approach moves beyond singular explanations, integrating the entire person, their mind, body, relationships, culture, and environment to achieve a comprehensive understanding for diagnosis and treatment. It emphasizes the personalized care and promotes empathy by considering the diverse influences on an individual's mental well being. Rich quantitative data. They generate rich quantitative data that capture the subjective experiences and perspective of the individuals. From that, they can start treatment. Examples in abnormal psychologists, Finney's gauge, the classic example illustrating how brain injury can profoundly affect personality and behavior. Jenny, a case study that provided insights into critical periods of language development and the impact of severe isolation and abuse. Grinth, a fictional case study illustrating personality disorders, demonstrating how past experiences and social isolation can contribute to bitterness and antisocial behavior. Sony, a case study of a person experiencing psychotic symptoms such as hearing voices and how these symptoms interfered with his ability to function. In future videos, we'll discuss about case studies of abnormal psychology one by one. We have done. Please subscribe our YouTube channel.